Okay, continuing with treatment of the cervical spine, I showed you this video is going to be for self SNAGs, okay, or self mobilization with movements to the cervical spine, and then we're going to do some self nerve glides, okay? So, the joint mobilization that I showed you in the last video where I used my thumbs on the spinous process to help do a mobilization while the patient was turning their neck into rotation. What are you going to send your patient home doing, okay? Or what would be an alternative to me putting my hands on the patient and doing that mobilization as he moved? I could use a strap, okay? And this is just a simple yoga strap. You could have your patient use a dog leash or a belt or something at home. They could use the edge of a towel to do this, okay? So be resourceful. But I happen to have this nice yoga strap, so we're going to use it. So Julian, we're going to put this around your neck, okay? Now, let's say we're going to keep it consistent with, that way. I'm going to keep it consistent with with what we treated in the joint mobilization section, okay? So let's assume then that we want to improve left rotation. And I knew that when I treated him, we were at the bottom, really kind of C6, 7 area of the cervical spine. I'm going to tell my patient, I want you to position the top part of this belt as low down on your cervical spine as you can get it. Okay, you're going to cross the straps this way. Oops, what am I doing? There we go. This one is going to, for stabilizing. This hand, I want you to bring your hand, so the strap is going to end up across his cheek somewhat. His hand is going to be about level with his eyes. Move to the side a little bit so they can see that now that this strap is up at about a 45-degree angle from the horizontal, okay? So what I'm going to have you do now, before you start rotating your head to the left, I want you to give a little bit of a pull this way with the strap. But I don't want you here, I want you about level with your eyes. You're going to give a little bit of a pull this way, and you're going to maintain that, and you're going to rotate your neck to the left, but you're going to come this way. Good. So he's maintaining this pull this way, and he's using the strap to assist left rotation, and then you're going to come back to neutral, to the middle. Okay? And you're going to do that 6 to 8 times. Now, what I should have asked him is after we did that first one, does that decrease your neck pain?
Yes.
You know that's the right answer. If that's in fact true, and he was able to turn his neck to the left with this pull and assisting to left rotation, and his symptoms were improved by at least 60%, make sure your knuckle isn't in the way.
It's not.
Okay. Then he would maintain this back to neutral, and then he would repeat 6 to 8 repetitions. If it really didn't help, and he was like, oh, it feels worse, then he's going to reposition. You know, maybe he moves up a little bit in his neck, and then he tries again. Okay? So go ahead and, good. Come in so they can see a picture here from the front. So go ahead and rotate that way. Perfect. And then come back. Okay? So you can see he is doing a self-glide in the plane of the facet joints of his cervical spine to assist with left. You got to make sure you come all the way back. Perfect. Okay, and if you want to, you don't have to hold that far. You can keep it here if you want.
Yeah, it'll be easier.
There you go. And try it again. Okay. That is a self-natural apophyseal glide using a strap for assistance. Now, let's say we wanted to work on extension instead. You're going to hold here. Nope, no crossing this time.
Okay.
Okay? So it's still going to be, you're going to find the offending level. The patient may just have to try a couple of different levels to find that level that decreases their pain when they do the movement. So we're going to pick this one. Now you're going to hold here, but you're going to be up at your eye level at least.
That's my eyes, yes.
Okay? So that we're up at about 45 degrees. And then he's going to go into extension. Your hands are going to travel, and so you can keep watching your hands with your eyes. Good. And then come back. Okay? So if you look from the back, come around the back. Back to neutral here. Don't let it slide up your neck. Go ahead and do it again. So you can see, after I move this massive hair out of the way, it's helping those segments glide into into extension. Okay, so he would find that level that gave him at least 60% relief and or an improvement in his range of motion. And I'd probably have him do 2 sets of anywhere between 6 and 10 repetitions. And if it really was symptom relieving for him, he could do that a bunch of times throughout the day. Okay, that is for those self snags. So there's a self snag for rotation and extension in your PowerPoint. Now, the last thing I want to do, and I'm going to show you this one, so you can go ahead and sit down, Mr. Miserable.
Need this strap.
No, I do not need the strap. Okay,
Strap
so
on.
so we talked about in the last video the using at the end we did the neurodynamic sliding techniques. Okay, so what are you going to send your patient home doing? For the median nerve, I like to show people a self-mobilization of the median nerve that's called freeing the bird. So I'm going to start here. So I'm going to do it in sitting. Your patient can be standing. It doesn't really matter. But you're going to imagine you have a cute little birdie, and your cute little birdie is sitting here in your palm. And I'm looking here at my cute little bird. Okay. I'm sorry, my cute little bird is over here. So I'm actually side bent towards the left a little bit and rotated. Every part of my nervous system up here is really put in a slack position, but I have tension up here in this proximal part of my brachial plexus because I'm side bent away from the offending side. Okay, so I have tension here, but this whole side here is on slack. So I'm looking at my cute little bird, and then I'm going to set my little birdie free. And I'm going to set the bird free like this. So now you can see that in order to watch my bird fly away, I have now side bent and rotated towards the involved side. And my upper extremity out here is in extension. My wrist is in extension and my fingers are in extension. Okay? And then I'm going to bring my little birdie back in because he's come back to visit me. And I'm going to look at my little bird. So now I'm back on tension and slack. And then we're going to set the bird free. So now I'm on tension, now I'm on slack here and tension out in my extremity. Okay? And I'm going to repeat this bird that keeps revisiting me, and I'm going to keep setting the bird free 10 to 12 repetitions. And that is my freeing of the bird. Now, if I want to do a mobilization technique or a gliding technique that is more targeted towards the ulnar nerve, okay? Sometimes what I have people do is if you do this, I can't do this because I have some ulnar nerve tension, but I do this with my fingers and try and make some upside down glasses. If your patient can't get there, and like me, it starts sending some weird stuff out here, to me that's a positive test, positive neurodynamic test for me. Okay, but what I'm actually going to do, so you can play with that and just see if you can do it. Okay, but to turn this into a gliding technique, okay, my arm is here. Remember that this was a combination. It was pronation, wrist, and finger extension this way, and then we flexed the elbow and brought it into abduction. So about here is my limit. Okay, if I side bend this way, coincidentally, some of my symptoms actually do become a little bit less. So here, I'm on slack, but I'm still on tension. Okay, now we're going to do the opposite. We're going to put slack here and tension. And slack and tension. And so I'm alternating slack and tension on each end of this neurodynamic chain. So this is what, throwing the basketball?
Yeah, it's like you're shooting a ball. Shooting
right, so I'm, whoops, now I'm all bad. You got me all messed up.
You're shooting a hoop.
I'm shooting the hoop. Except I'm looking in the opposite direction, so I'm not actually looking to see if the ball went in the basket.
That's not the important part of shooting.
Okay. It isn't?
Nope.
Then what is?
The shot. Doesn't matter if it goes in.
Okay. So that would be for the ulnar nerve. For the radial nerve, okay, Now I realize there's not as much stabilization with these techniques as when you evaluated with your patient, or if you choose to treat the patient right after you're doing the neurodynamic testing, then yeah, are you stabilizing and making sure the scapula doesn't elevate? Absolutely. Are you making sure all the itty bitty little components of these positions are there? Yes. So these home exercise treatments, they're not perfect, but they're enough to really get things moving. So for the radial nerve, if you remember, it was a shoulder internal rotation, wrist flexion, finger flexion, and then an abduction. Okay, so I'm going to come out here, find if I was positive for this one, which I am not. Okay, I'd find that spot that felt provocative of symptoms. I'm going to back it off a little bit. Okay, so that side's already on tension, so I'm going to go ahead and put this side, this proximal part, on some slack. Okay, and then if I'm going to put tension over here, then you see my hand?
Yeah,
Okay.
I got it.
Then I'm going to put slack in this end of the chain as I put tension here. So slack and tension, slack, tension. Okay, so you can see I'm alternating these movements. It's almost like if you can envision a rubber band that starts here in your neck and goes all the way out here to the hand. Okay, you're creating a sliding motion. Okay, you're going to slide out this way if you put slack in the system here and tension out here, and then it's going to come this way. So I want you to, if you need to picture it this way, that's sort of what's happening. Okay, so play around with those. Those are 3 great self-nerve mobilizations so that you can give your patients some really great things to work on at home.